Well, good afternoon, everybody. And we have as you've noticed, we have a new venue today for today's meeting, and we want to thank our colleagues at the Multnomah County Commission, particularly Commissioner Deborah Kafori, for inviting us into their home today. Thank you. I'm Portland City Commissioner and Allocation Chair Dan Saltzman, and I'd like to welcome you to the Portland Children's Levy Allocation Committee meeting. And before I begin with the introductions of the Allocation Committee, I am very pleased to announce our newest member on my far right, Julie S. Young, who was unanimously approved just yesterday by the entire Portland City Council. And she gave a great acceptance speech to the City Council. I think everybody was very moved by that. So Julie is the city-appointed citizen representative. She replaces Alyssa Kinney-Geyer, who I think, as everybody knows, was appointed to fill Representative Ben Cannon's seat in the state legislature. So Alyssa is going to be very busy in a few days as the legislature convenes in its first annual session. So Julie comes to us with many years of experience as a longtime youth advocate and community volunteer. She has worked with organizations such as the Children's Trust Fund of Oregon, the Oregon Community Foundation, Social Venture Partners, and the City Club. She holds a Master of Social Work and has spent much of her career working with diverse populations and vulnerable families through her work as a court-appointed special advocate and as a community mental health practitioner. So we want to welcome you, Julie, and we're glad to have you on board.
Thank you.
And on my immediate right is Adrienne Livingston, who is the Multnomah County Citizen Representative. On my far left is Ron Belts, who represents the Portland Business Alliance. And on my immediate left is Multnomah County Commissioner Deborah Kafori, who represents the Multnomah County Commission. Now I'd like to introduce the Portland Children's Levy staff. Director Lisa Pellegrino, who is in charge of after-school mentoring investments. Meg McElroy, who is in charge of early childhood investments. Lisa Hansel, who supervises the foster care and child abuse prevention and intervention investments. Communications Director Mary Gay Broderick, and Fiscal Specialist John Kelly. So before we get started, I'd just like to give some background on the levy. The Portland Children's Levy was created by voters in 2002 and overwhelmingly renewed in 2008. The levy annually provides $10 million to support organizations that are reaching 17,000 children and their families with proven cost-effective programs in early childhood, after-school and mentoring, child abuse prevention and intervention, and helping children in foster care succeed. The levy operates within a 5% administrative cap, so that 95 cents of every dollar goes directly to proven programs that achieve positive results for the city's most vulnerable children. We have also extended the levy's reach through our $6 million leverage fund, which matches public dollars, our dollars, with private dollars to make more resources available to programs that are helping the city's children. So back to today's business. First of all, we need to begin by approving our minutes of our December 12th meeting. So I would entertain a motion to approve.
So moved.
Second?
Second.
Okay. All in favor, say aye.
Aye.
Aye. Okay, the minutes are approved. Next up, we always have a public comment period, and this is a portion of the meeting we set aside for anyone who wishes to speak to us about any topic related to the Children's Levy. Do we have anybody that wishes to take advantage of that? Okay. Seeing none, then we will move on to our first agenda item, and this is a presentation on the Community Child Care Initiative. As you may recall, the initiative was a $2.7 million levy investment made in 2007, and it had two aims: to strengthen the quality of child care in child care centers and to make child care more affordable for low-income families. So we're pleased to welcome Shannon Lipscomb, who will be presenting the evaluation results of the investment. Shannon holds a PhD and conducts research on children's development of school readiness within child care and early education centers, and evaluates programs throughout Oregon trying to improve the quality of early learning. So welcome, Shannon.
Thank you so much. I'm very pleased to be here. And in the sake of time, I'm just going to go ahead and jump right in. One thing I will say is that for those of you who have a copy of the slides with the notes page, there's more information on the notes than I'm going to be able to go through today. So if you have questions about information that I don't get through, feel free to ask questions at the end or contact me for further information afterwards. Okay, so a quick overview of the program, right? The Community Child Care Initiative, I'll call it the CCI sometimes as we go through for short, was funded at $2.7 million over 5 years, okay? And it's implemented by the Child Care Resource and Referral of Multnomah County. It includes two primary components. The quality services aim to improve the quality of child care centers in Portland through making work plans and some financial assistance to make targeted improvements on quality indicators as outlined in the statewide quality indicator program. So those are things like group size, ratio of children to adults to children, training and education of providers, and things like that. Okay, the second component is the affordability services, and those are aimed to increase access to quality care for children from low-income families in Portland. And low income being defined initially as 185% of the federal poverty level or below. That was changed to up to 200% of the federal poverty level in the middle of the program in order to improve and increase enrollment. And then due to over-enrollment and limited funds, reduced back to 185%. And I mention that because some of the findings are pertinent to those changes as we move along. Okay? All right, so the evaluation addressed three questions. Okay, the first was, do quality services lead to improvements in child care quality? Second was, do affordability services improve access to quality care for children from low-income families? And the third was, does the CCI services, do they facilitate and reinforce a broader network of support for child care quality in Oregon? Okay, and the design was implemented over a 2.5-year period and included a whole variety of data collection, including surveys, interviews, and a review of external data on child care quality from the quality indicator reports. And the participants included 180 parents, and they were mostly single working mothers. And you can see that their income was not much higher than their actual total monthly child care costs. And then the child care providers that participated were all of those that were involved in the quality services as well as the affordability services. And in addition, a comparison group of child care providers that were not participating in the program. And that decision was made in order to improve the confidence of the results, to have some comparisons to make so that we're not just looking at improvements in those that participated, but do they improve more than those that didn't participate in the program? Okay, and I should mention also that the families and child care providers were followed longitudinally over time over this 2.5-year period, so that we're not just asking participants at the end, hey, did this improve things for you? What did you think of the program? But actually doing a more rigorous analysis of improvements over time for families and child care providers. Okay, so this slide is a summary of the 3 results for the quality services. The first is that that quality services help providers to become more familiar and to encourage commitment to the quality indicators, okay? And this was evidenced by statistically significant improvements from pre-survey to a post-survey, before and after participation in the program, significant improvements in these areas, and not only compared to pre and post, but also compared to providers that didn't participate in the program, okay? The second finding, I'll go into a little bit more detail in the next couple slides because it's really a key finding, is that there was evidence of tangible improvements on the quality indicators, those 7 indicators on the statewide quality indicator program. And the third is that there's at least some potential for the quality improvements to continue and be sustained. The evaluation wasn't able to follow the participants long enough to make really solid conclusions about that, but that there is evidence that the providers improved on things like familiarity and use of existing community resources that do support child care quality, that they can continue to access even after they're not participating anymore, and so that they're setting up a framework to continue making improvements over time. Okay, so this slide represents the first of two that show the improvements in quality. Okay, there's two sources of evidence for improvements in quality, and the first is through surveys, the pre and post surveys, where child care providers were asked how much improvement they were making in these different areas. And you can see that the colored lines represent the different 7 quality indicators. And here the comparison group of providers declined in the amount of improvement, not the overall quality, but the amount of improvement they were making in these areas over time, whereas those that were participating in the program indicated that they were making statistically significant improvements and increases in improvements over time. Okay, so those were statistically significant increases and more than the comparison group, okay, from self-reported surveys. The second line of evidence is for the external, more objective source of evidence on child care quality from the Quality Indicator Program. And this slide has a lot of information, but what you basically want to do is look at, in the orange are the quality indicators, okay? And then each of those bullets represents a different variable or a way of measuring that indicator. Okay, so and they're color-coded. The green and the blue represent generally good, positive improvements. The green is the strongest evidence because we're looking at significant improvements that's exceeding those that were made by child care providers that were not participating in the program. The blue is significant improvements compared to their own baseline from the beginning, okay? The red are the two areas in which, and they're interrelated variables, in which the facilities that were not participating in the program actually made a little bit more improvement than those that were. So that was an area not as well touched by the program. The black areas are those that didn't see any improvement. Okay, so if you look overall, you see more green and blue. Okay, we do definitely see quite a bit of improvement, and some in each area for each indicator other than accreditation. But we don't see that every single area is significantly improved, okay? And this is consistent with the goals of Community Child Care Initiative, in which providers are asked to develop very specific work plans around a few key quality indicators. They're not asked to make changes across the board in everything. These are things that are very difficult to improve. They're structural indicators of quality that take a lot of time and effort and money to improve. And so seeing quite a number of them improve, I think, is something is quite positive. Okay. So for the affordability services, this slide represents a summary of the findings, and I'll go into details on just a couple of them. Don't have time to go through all of them today. But for the families, there are two overall findings. The first is that the CCI promotes quality and stability of child care in two different ways. So for some families, it allows them to continue utilizing quality child care that they were already utilizing prior to participating, but then they experienced a loss of income. We had a lot of families that experienced loss of income due to family separations and divorces, due to decreased hours and decreased pay at work, decreased earnings, okay? Sometimes loss of child support. And those families indicated that otherwise they would have had to leave to a less expensive child care provider that wasn't as high quality. The other way was that another set of families was able for the first time to purchase quality care that they were never able to purchase before. And the second finding was that the CCI promotes stability of family finances. Okay, now this is something that there's also research showing not only is quality child care important, but family finances can precipitate a negative pathway within the home environment that affects parenting and affects children's outcomes through kind of a whole other pathway, through the home pathway. For providers, there are 3 sets of outcomes. So the first result was that the affordability services helped providers to enroll and retain the low-income families. Second, number 4 result there is that they increased income for child care providers that served low-income families. Okay, and that then those providers were able to reinvest that income back into their programs to continue to improve quality care. Okay, so I'm going to go into a little more detail on a few of those. So the first for families, right, that we're looking at improvements in quality and stability of child care quality, of child care. So the families were asked at the end of one of their post-survey questions was, what would you have done if you didn't have the support in the last 6 months? How likely would you have been to switch providers or miss work or do other kinds of things? And when I combined the results from a couple of those questions together, I came up with this chart here, which showed that 75% of them would have had to either miss work, switch to a less expensive provider, or do a combination of those things. Okay, that's what they said they would have had to do at the end of that 6-month contract period. Well, then I was able to follow up with families that eventually did actually lose support from the CCI when the policy changed the eligibility period. You know, I described earlier that it was moved up to 200% of the federal poverty level, then moved back to 185%. Well, a lot of the families lost their support at that time. And I followed up with them and did a lot of qualitative interviews with them and with other families that were able to maintain and continue. And the results basically showed the same pattern, that this is essentially what families did when they lost support of the CCI before they were ready to move on their own, is that they pieced together a combination of switching to less expensive care, decreasing their hours at work, and that there was a small subset that didn't have an impact that were able to somehow make it work without. And there's a few different subsets of those families that seem to be able to successfully navigate that transition out of the CCI, and those are outlined on your notes. There are things like you know, first of all, the families that were able to stay on the program long enough to bridge to another form of assistance. Families that were able to achieve self-sufficiency or at least increased earnings. There weren't a lot of those, but there were some. And families that somehow were able to gather enough resources to make it work without the support of the CCI. And they said things like, I would just do anything it takes to stay with this quality provider that I feel like I trust and is good for my kids. Whether it's taking on 3 jobs, whether it's credit card debt, whatever it is, I'll figure out a way. And there's also a quote from a family that I wanted to share with you guys that moved on, that was able to move on successfully. She said, I will always look back at that time as the time I needed the most help, and the CCI was there for me. And she has a really great story. The full report, if you're interested, outlines her whole story of her experience. But for the large remainder of families, they really did need the CCI in order to be able to successfully continue with quality child care providers. This slide shows the impact on family finances, and you'll see a pretty dramatic, and it was a statistically significant improvement in family finances during the participation in the CCI. But then when the families left the Community Child Care Initiative for whatever reason, sometimes they were ready to move on, other times it was they lost eligibility for the program, then you see them reverting back to similar levels of stress and worry and decreased satisfaction with their finances afterwards. Okay, so for providers, this slide is just one of so many different charts out of the full report about impacts, and it summarizes, I like it because it summarizes a couple different areas. Okay, so you'll see providers were asked how much the program had an impact at the end of the program, how much of it did it impact these various areas. Okay, and you'll see the largest impact in their own perspective was on retention of children and families, but also some impact on their income and stability of their income, as well as the number of low-income families that they were able to serve. And a little bit more detail about the income impacts was that over 50% of them, I think 56%, indicated that they did have either a lot or some impact on their child care income, overall income from child care due to participation in this program, and that they were able to reinvest that back into their programs by doing additional trainings for their staff, by sometimes hiring additional staff to improve ratios and group sizes and things like that.
I'm not sure I understand in that slide. If you can go back one.
Yep.
The orange colored bars versus green colored?
Sure. So I colored the ones orange that had a rating of a 2 or higher, which was equal to about a sum on that scale from not at all to a lot. Mm-hmm. And those were ended up being the things that related to serving, to basically enrolling and retaining low-income families, as well as impact on income.
Okay.
Yeah. Okay, and the last finding relates to the final research question about a network of support. And there was evidence that the CCI reinforces a broader network of support for quality care within Oregon. So rather than reinventing something totally new, the CCI capitalizes on existing resources and reinforces those. So providers participating in both components of the program, affordability and quality services, showed statistically significant improvements over time in their familiarity with existing resources and supports, with their utilization of them, and with their familiarity with the quality indicators. So those are all things. So when I say existing resources, it's things like services from the child care resource and referral networks, it's accrediting agencies, it's the Oregon Association for the Education of Young Children, things like that that are existing, going to continue, and that by building building off of those, the CCI is able to reinforce, this existing network. The quality services, in addition, was specifically geared towards increasing engagement with the Quality Indicators program, which is a core statewide program that's really at the forefront right now in the statewide effort to assess and improve child care quality. And the affordability services then reinforce those standards by requiring providers to maintain and demonstrate a certain level of quality on those statewide quality indicators in order to qualify for the program. Okay. So in conclusion, you'll see evidence to support all three of the research questions, the three aims of the program. Really, the largest remaining question for me as an evaluator is the extent to which these benefits can be sustained after families and providers leave the program. We saw a mix of some evidence for potential for sustained improvements, but then, for example, with families, we saw some reverting back in terms of finances, that graph that went up and then right back down after families left the program. So it's an area that needs more attention, and we don't have enough evidence right now to say, really, whether we expect which of those benefits really will be able to be sustained after families and providers leave. Implications are, the first one here that I have outlined is there's preliminary evidence, though not yet conclusive, that combining the supports for improving quality and improving access may precipitate a cycle where those two parts of the programs mutually reinforce one another and make them more effective than just doing a quality program or an access affordability program as a standalone. Okay. And second, that reducing the cost of quality care for low-income families can make a real difference. Okay, this is really different than the statewide, the employment-related daycare program, because it's specifically tied to quality. And so you'll see an impact on quality and stability. And a few of the nuances I wasn't able to get into in more detail yet in this presentation, but are in the full report, is that families were able to manage an increase. Initially, they only had to pay 10% of their income for child care under this program, and that was increased to 15%. They were able to manage that transition. What they weren't able to manage was a loss of the benefit altogether, and that was true for families between 185% and 200% of the federal poverty level, as well as those below the 185% of the federal poverty level. For both groups of families, the benefits were similar. And in addition, the stable quality care often means more stable employment and fewer days of missed work and financial impacts as well. Okay. Oops. A couple more quick things I wanted to mention is that I am also doing planning around submitting some of this work for publication in a peer-reviewed academic journal. The reason I mention that is because considering the academic research and what's out there right now, I think that a program like this and the evidence that I found through this evaluation is actually something that can contribute to the larger understanding of how do we improve child care quality for kids, how do we increase access to quality care for low-income families, and there's some findings that are really nice and pretty unique from this study that I'm going to work on submitting for publication as well. And the academic research is also trying to address another kind of larger question. If we step back for just a minute and think about, okay, so this program has some really nice outcomes, right? Okay, the evaluation demonstrated in pretty successful way that the program's meeting its goals. But then the next question is, well, how long do kids need to be in quality care? And how high does the quality need to be in order to see the kind of outcomes for kids that we want to see? It's beyond the scope of the evaluation here to track children's outcomes. That's very costly and time-intensive and takes a long time to do. But the academic research is trying to understand those questions. So it's important to also stay tuned with what's going on in that kind of research. And I'm involved in that kind of research as well with my university hat. So you can always feel free to contact me for more information about that kind of thing in the future. And I think that's it. So we have a few minutes for questions.
Okay. Well, thank you, Shannon. Questions?
Where can we find a full copy of your report, the copy of your full report?
We can email it to you, Deborah, but it'll also be on our website after today.
Great. Thank you so much.
So
I'm sorry, I have one other question. It says on the slide, but I just wondered if you could just really briefly, I know we don't have a lot of time. Can you go over exactly what was offered in the program in terms of the quality services and what was offered for affordability specifically? So, because it's it's kind of up here. And so what does it mean to the family when I saw that they only had to pay 10 or 15%?
Right, so for the affordability services for the families, for them it's financial support, so they only pay 10% of their income for childcare. And that's basically the extent of the program for families is that financial assistance that goes to their provider. So they didn't pay more than 10%. That was increased to 15%, so now it's 15% for the families. For the quality services, the providers they work with a coordinator at the Community Child Care Initiative and to develop a very specific work plan around making targeted improvements on those 7 indicators of quality. They choose which ones, they look and see, okay, where are my limitations, where are my strengths, how can I make improvements so that I can really be demonstrating a higher level of quality. And they have technical assistance. They participate for a year at a time. They can renew after that year if they still need to make more improvements and they've been showing good success. For up to 3 years, they can get up to $16,000 per year for up to 3 years to make very targeted improvements.
Thank you. This is really interesting, especially and timely, in fact, in light of the fact that in February the legislature could be continuing or deeper cuts to the TANF services that they provide, which include child care subsidies. So it all kind of fits nicely.
It absolutely does. And it's
together.
quite unique in terms of tying the financial assistance to quality, not just providing financial assistance for care, but for quality care. And there are some states around the country that are doing this at a state level, tying the financial support to actually to quality care in particular. Yeah.
Thank you.
Sure.
Good.
I have more of an observation. I think that the work that was
I think you need to push the red button there. There you go.
Okay, there we go. So I think the work that was done was great, and all of the indicators and everything that you have presented. It's just more so of an observation is looking at the ethnic groups and with the different studies that we've done, even with Grant Makers of Oregon and Southwest Washington, seeing the different disparities that there are specifically with African American kids and Latino kids. I do like, that the ethnic breakout, there's 20% black, 55% white, but the Latino just surprised me as it was so low, 7%. And then, Native American, 2%. So just kind of, in my mind, it raises those questions. One, I do know that there is a limit to the families, obviously, that can be within this program, but then why some of the other ethnic groups are so low. But when you take all the ethnic groups together, it is 45%, which is great, but still just looking at the different.
Do you want to comment on that,
Yeah,
Ben?
sure. That's just the sample, too, of the folks who participated in the evaluation. What's interesting, I think, is that the evaluation sample wasn't necessarily as representative, maybe, of the overall population of participants who participated in the affordability services. And so actually those proportions of folks of color go up, and I can send you those numbers specifically. I don't have them offhand, but I think the Latino numbers go up closer to 10%. The Native American figures might stay still at 2%. It's a lower figure, but in any case, those. And I think if I remember correctly, the proportion of children who were identified as African American or whose families identified as African American stayed around that 20% mark as well. So,
all right, thank you.
Sure.
So, one of your first slides said that the average monthly income for the 180 parents you looked at were
Just under $2,000 a month.
just under $2,000, and the child care cost is about $1,700.
Yep.
So those at that income level, they're getting a subsidy from
So
state so that they don't pay more than 10 or 15% of their income?
Okay, so the families that were at 185% of the federal poverty level or lower that qualified for the employment-related daycare at the state, from the state, were required to first apply and receive the state support. So some of that $1,669 figure was paid for first by the state. But then there's the copay that's required of the families often, typically, exceeds 10% of their income as well. So then the CCI was filling in the gap between the ERDC subsidy up to the 10% or the 15% of the family's income. But for the families that were between 185% and 200%, the CCI was paying all of that with the exception of the 10 to 15% of the family's income that they were paying themselves, because the state does not pay for child care for families exceeding 185% of the federal poverty level.
And is the state subsidy like a federal pass-through or?
So there's a federal program called the Child Care Development Block Grant, and then that's transferred to the state to make decisions on how to allocate that.
It's a block grant.
Mm-hmm. Yep.
Okay. Any other questions? Thank you, Shannon. Which university are you associated with?
I'm with Oregon State University,
Okay.
and I'm on the Cascades campus over in Bend. So,
Okay.
yeah.
The new place.
Thanks for having me.
Great, thank you very much. So moving along, we'll be asked now to vote on an out-of-school time intermediary proposal that we gave a conditional okay to back in February of 2011. And this was not a challenge grant, but it was
a collaboration grant.
Collaboration grant, okay. So before we make a decision, we're going to hear from Lisa Pellegrino on the background of that proposal along with the staff's recommendation.
So just to refresh folks' memory, because this was quite a while ago that we discussed this, when we were approving and looking at collaboration grants, those were generally smaller grants that we were attempting to work with other funders on, essentially, to create rather than, so we formed a collaboration committee. Alyssa Kenny-Geyer was the allocation committee member represented on that committee, and there was a group of other funders that came together to both generate and consider proposals that we might work together on that were, they kind of came up with criteria and included things like systems-related projects that were going to affect more that were not so much geared towards services, but more geared toward affecting systems. So one of the proposals that came to that committee was to form an out-of-school time intermediary to primarily focus on quality improvement and training and professional development in the out-of-school time field, which again, sort of a systems-related, broader proposal. When we brought it to this committee, you all approved it or conditionally approved it, and you wanted to see them garner some other support from other funders. So they were in the process, of doing all of that, and then an opportunity came to apply for a grant through the city of Portland was invited to apply by the Wallace Foundation for a grant to fund out-of-school time systems, which looked perfect, we thought, to help get some additional seed funding for this concept. Through a long series of events, we were not ultimately successful in getting that grant. The City of Portland was not successful in getting that grant. And also in the meantime, of course, things have changed at the Levy in terms of financial prospects, which we'll discuss shortly. And as well as one of the organizations one of the other funders of this project that was going to contribute significant staff time to making this happen, that staff had to be laid off. And so the combination of those factors, also one of the leaders in the group is taking a new job in another place. So there's been just sort of things that have happened over time that I think have led me to the staff recommendation that we not go forward with this grant at this point because there is no other funding, and a number of the in-kind resources have evaporated, unfortunately, in these rotten economic times. And given our Levy situation with revenues, I'm not recommending we make start any new projects at this juncture. So that's our staff recommendation. If anyone has questions, I'm happy to answer. I know, Julie, you're all new to this. Hopefully I gave you enough background to understand it.
So the recommendation basically is we do not go forward with this grant, and that would be what we would vote on right now.
Correct.
Okay.
It was a conditional approval, so I guess retract the conditional approval.
Okay. Does anybody have questions before we move to a
I was
vote?
just wondering if anybody was going to testify on it.
Oh, did we have anybody here that wishes to testify? So one of the people who was instrumental in getting this all going is Keith Tomajon. And Keith, as most of you know, in a few days, I believe, he was the head of Campfire USA, and he will now become the new executive director of United Way in a few days. So there is hope maybe that through United Way that there might be, at least in my thinking, there might be some hope, because I know he was a big believer in this, that there might be something through United Way that might help maybe jumpstart this at a later date.
That's correct, and he is most assuredly still committed to this idea. And I said, if there's any way for us to be able to help support this, if you're able to bring it or a version of it forward again, we would love to consider it. But it's going to have to probably be at a later date. I'm sorry. Do you want to say something?
I just also wanted to say that I think that at least I still feel really strongly about the original intent, and it's unfortunate that both financial circumstances and other circumstances beyond our control I think this is the wise move, fiscally prudent move, but hopefully it will resurrect itself in another form with maybe another organization.
That's what I'm hopeful for too, and certainly I've made it clear I put my own personal effort into whatever creating it. So I use my staff time when I can to support that type of thing.
Okay, I'll entertain a motion to revoke our conditional approval of February 2011.
So moved.
Second?
Second.
Okay. Moved and seconded. All in favor, say aye. Aye. Any opposed? Okay. Thank you, Lisa. Now we're going to have John Kelly, our fiscal specialist, who's going to give us a financial update of the revenue reductions the levy anticipates in the next 2 years. As you all know, reduced revenue is the result of a depressed housing market and compression. Compression, something that was created under Measure 5, Measures 47 and 50. And that's been brought about by lower real market property values. So unfortunately, that translates into some steep cuts for our grantees the last 2 years of the current levy. It's a sobering issue that we will be delving into more in the next few months. And John, what type of scenario are we looking at?
Thanks, Dan. Well, you summarized the big news. The headline is there's a lot less money than we hoped. Josh Harwood, who's the city economist, he tells us every year in January how much money are we going to have next year. He actually always projects out the entire life of the levy. So we're dealing with 3 fiscal years. The year we're in, which we call fiscal year 12. So the first bullet, well, the second bullet on that, you can follow along in this green piece of paper too. So it's the first bullet on there is about this year. In our last meeting, you all decided 4.5% cuts for current grantees. So Josh said, yes, that will work. There's enough money to fund all of those. We don't have to make further cuts to this year. So that's the small piece of good news. The second, the next bullet there is that we will have about $9.2 million per year for each of the final 2 years. So now we're talking about fiscal year 13 and fiscal year 14. The current levy ends June 30, 2014. So that projection assumes that the library stays as a local option at the rate of 89 cents per thousand for those last 2 years. That may or may not happen. And so well, I'll get to that in a second. So given those revenue figures and that amount of availability for grants, we have to reduce expenditures by more than we thought, 27.5%, about $3.7 million per year over the next 2 years. So this year we're staying with the 4.5% cuts, but next year we have to make deep cuts in the neighborhood of $3.7 million. If you add up the current budgets of
That's $3.7 million for each of the 2 fiscal years ahead of us.
If that $13 million figure is a rough approximation of the current, what do we call them, competitive grants and all the leverage grants that are out there. It excludes the child care initiative because that is set to sunset at the end of the fiscal year we're in now. So Josh, the economist, is reasonably confident about the revenue projections for next year, fiscal year 2013. He's also confident about this year because there's no chance that the library could change its status next year, and the real market values that determine the taxes that result in our revenues are already set. Those are set in January. So we'll collect that money November, December, and throughout the next fiscal year, but the values are set. So he knows how much the real market values will, where they'll be.
And if I could just to clarify for those, I don't know how familiar people are with library funding, but the library is set to go on the ballot for renewal of its current levy this May at 89 cents a thousand. So that is the same rate, and if assuming that levy passes in May, that will be the rate that for the library for the next fiscal year. That would have no possibility of changing during the next fiscal year, which contributes to his confidence around being able to project what next year's revenues are likely to look like.
So if it passes, his numbers are likely to be accurate. If it doesn't pass, then there'd be slightly more, but probably not significantly more. So the uncertainty is for the final year of the current levy, fiscal year 2014. We don't know what the Multnomah County Library District will do, if it becomes a permanent levy at about $1.18 per thousand, so a significant jump in the rate, and also a change of status, which I think most of you folks understand, but it's complicated to get into. It become a permanent levy rather than a local option. Our compression would significantly increase, and Josh's off-the-cuff number is $1 million less revenue. So,
Not really so much due to compression, actually due to the increased rate.
yeah, rate is the bigger chunk of that decrease, but that is by no means even a reliable figure. That's just a ballpark. So that $9.2 million of money for that final year would drop $1 million to 8.2. The other unknown is real market values. Real market values provide a cap for property taxes. Without getting into too much detail, when those go down, our revenues go down. 2 years ago, real market values went down an average of 6%. Last year, they went down an average of 5%. So, and we've seen steady declines in our revenues. So if they stay flat, then we can actually, because assessed values in some properties go up, it gets really complicated. If they stay flat, the hope is that Josh's projections would be pretty accurate. But 2014 is a long way off in terms of what will markets do. So we have a lot of exposure there. It's significant for us what happens to real market values for our revenues and our ability to grant funds. So the final bullet, to remain within the 5% cap that's on the ballot language for administrative spending, we need to make fairly significant cuts, 19% cuts for fiscal year 13 from the original fiscal year 12 budget, and that will necessarily include significant cuts to staff hours. We've projected 100 hours. No, a lot more than that. 400.
Yeah, right.
500 hours less staff time in the year. So significant. Basically, 10 hours a week less staff time. Yeah, if revenues are what Josh says, then that will work for us for next year. We'll be able to have that staffing up. Mm-hmm. So questions. It's complicated stuff, but we tried to get it down to the bottom line.
Can you go back to the first slide?
Sure.
Maybe the second one, actually. Okay. So if I just want to make sure, we were anticipating for the next two fiscal years, 13 and 14, roughly $10 to $12 million in revenues. And now we're looking at roughly $9 million for each of those years.
Yeah.
Yeah, I mean, I think you should really be hesitant to be thinking about 9 for that second year, because we just don't know. I really feel more comfortable with saying we don't know what that second year is going to look like, because if the library district passes in November, that will absolutely affect our revenues in that final year of the levy significantly. And so to try to forecast what that's going to be at this juncture, I think is probably not worth much if I were a betting person.
Yeah, for next year, I mean, it depends when you want to talk about. I was looking at old projections, 13, 14, 15 million, you know. Before the real estate market tanked, the numbers were glorious. Yeah, we would not have any. Our problems would be what to do with all this extra money. We were starting to talk about that, and then things changed.
Yeah. And the key thing, too, I mean, Josh also did let us know that, so for our next meeting, which is scheduled now for March, the process of analyzing what is happening on a property-by-property basis and how that real market value fluctuations affect that is an ongoing process of analysis. It doesn't, they keep doing it until they finally get the tax, that they give us the information in October. So if he has any more updated information or anything else he thinks would influence the situation for our next meeting, he's going to provide that. And then similarly, before we go into the funding meetings in April, if there's anything more to add to the discussion, it's possible we will have somewhat updated information that possibly might affect these estimates. So these are his best estimates for right now. He thinks he's, like I said, pretty confident for next year, but it's possible that some additional information could change that. So we will bring that forward to you, but this is our best guess heading into this season at the moment.
I've got a question.
Sure.
So could you walk me through?
You have to press your red button there.
It is. Could you walk me through how we line up with the renewal of the grants and the life of the levy? Meaning, does the renewal for the grant start July 1st, 2012 and go for 2 years? So there's one additional year without the funding? Excuse me. So is there an additional year of the levy without the grants being renewed?
I think that's what we're going to tackle at our next meeting in terms of trying to make decisions, given this uncertainty. We've never been in this situation before where we've had uncertainty like this in the final year. Normally, we would have conceived of writing 2-year renewals, so a 2-year contract for folks who got a renewal, and you would be making decisions based on that. I'm not sure that's advisable, given the situation that we're facing. So we'll raise this issue at the next meeting for discussion and decision about how long do you want to renew the grant for. So that's, we'll bring kind of all the ramifications of that and what it would look like to you next time for a decision.
What's the last date that the levy runs through?
June 30, 2014.
Yeah, there are 2 more fiscal years left on the levy after the current year that we're in. And so the renewals that we'll be considering in the spring, the grants that all expire, it's all of the challenge grants and then potentially some others. Those are all contracts that had language written into them specifically saying eligible for renewal, for possible renewal, not guaranteeing renewal, but possible. So you all will be considering both what to do about that, whether to renew them or not, and if so, at what level, as well as how to spread the impact of these cuts potentially over all of the grants that we make, even if they're not in renewable contracts. So those are the things. We will lay out all of those parts for you for the next meeting. We didn't really have enough time in this meeting to, start walking down that path because it's a complicated set of decisions, and there's a number of other things we haven't even brought up yet. So we will bring those up for you and have a more robust discussion and set of decisions in March before we have to actually make the funding decisions.
Are there other questions? So I guess this is the point where we segue into, and maybe we kind of already have previewed.
You've kind of had the renewal preview, I think, at this point, but I will, let me see, did I forget
Why don't you just
anything?
outline what we're going to be doing in the next 3 meetings, I guess, to get at the tough decision of how do we reduce revenues for fiscal year 13 by now, as it stands, 27.5%.
Yes, okay. Oops, Meg just let me know I misspoke, so let me unmisspeak for a second. I was referring to all the challenge grants as being renewable, and that was incorrect. It's our competitive grants, 2 Cs. Competitive grants, which are the bulk of the grants that we let. That's by far the bulk of the money that the levy investments are in the competitive grants that were let in 2009. Challenge grants is a much smaller portion of grants that were let that Dan described in the beginning of his talk, and those are actually technically not eligible for renewal. However, you will have to discuss if and how much of cut they have to take as a result of the reduced revenues we're likely to have next year, or we're certainly going to have, not likely. So yes, I don't know that there's anything else more to say about renewal, other than in March we're going to set up those decisions that I just discussed, issues around, we'll talk with you in more detail about the kind of data that we're going to give you and make sure that's, kind of do a check-in with people to see that that's the kind of data that will be helpful and useful. Make sure there's nothing else we're forgetting that you'd want to know about the pool of grantees that we're currently investing in, as well as thinking about things like the allocation of the funds at the macro level over the different funding areas that we make. We had a certain sort of allocation percentages that we used, and do we want to keep that constant? Those kinds of questions. So some of the sort of precursor questions to actually making the funding decision, so we can be setting that up for the second 2 meetings in April. One change from the memo that I sent you last week, I think probably just given the timing of the allocation committee meetings that we were able to schedule for April, we will likely consider after-school and mentoring programs, the renewals for them in the first meeting in April, and then the other funding areas in the second meeting. So reversing the order just because of the timing of when we were able to schedule, and staff vacations and other people being out of town. So that's the only real change.
Okay, so I just want to be absolutely clear with our public in the audience and who's ever watching on TV. We will meet on March 5th. And April 9th and April 16th. And in those 3 meetings, or by the end of those 3 meetings, we will have made a decision of how to cut 27.5% of the expected funding we had in fiscal 13.
That's correct. And we provide, notice will go out to all of our contacts about all the meeting dates and all the times well in advance, and as well as, any agendas for the March meeting, those always go out too. So and they're all up on our website, there's many ways to access them.
And you said that the after-school mentoring would be in the first April meeting as
Yes.
opposed to the, okay, thank you.
Yes, that's the only switch. We just, when I wrote this, I didn't have the meetings scheduled yet. So now that I've been able to schedule them, and we know what vacation schedules are, also we have a new member, so wanting to take into account what's happening with her schedule, I think that we will be able to get that to work.
And we would also certainly ask the organizations we have invested in to be thinking about this as well, and we welcome their ideas and suggestions too. It won't be easy. We know this will not be easy decisions for any of us, but they are decisions that have to be made. We have to spend according to what we have in revenue. There's no two ways about that. So.
Absolutely, we want to make sure that everybody knows.
Visited just a little bit with Lisa about this too. But the other thing that's really going to be difficult too is we don't exactly have a lot of staff to start with, and cutting back staff, it will be impossible to manage 86 grants. I think it is.
We're over 80. Yeah.
So it's not just even if we tried to do across the board cuts, that won't work. We have to be able to manage less grants and grants that are less time consuming too, to be able to adjust with the same staff that we have. And, statutorily, we can't be over 5%. So
right.
Though we are going to have some tough ones, but, we should plant that seed because it is going to be very difficult.
Yeah, no, that's an excellent point, Ron, is the fact we may not be able to sustain administratively 86 grants. We may have to revamp dramatically. Any other comments or questions? Okay, well, then we're at the last item on our agenda, which is the second part of the annual Levy data presentation. Staff presented at the last meeting the demographics and performance issues, and today we will share with us participation, outcomes, and staff turnover data for the organizations that we invest in. So I'm Lisa Hansel and Meg McElroy. Oh, and Lisa Pellegrino.
We all have a part to play.
Okay.
Although I have to give Meg McElroy a call out. Meg is the spreadsheet guru in our shop, and she helped us compile and do these nice charts that you'll see, the nice visuals, which Lisa and I admitted complete failure at creating. So if it were not for Meg, you wouldn't be seeing pretty colors and nice charts. You'd just be seeing a lot of bullets, which is far more boring. So we'll do our best to make it as interesting, and we'll try. And please, I would say interrupt us with questions as we're going along, because this is long enough that you're going to forget your question by the end. So, we will do our best to be as efficient as we can and not dump too much information on your head. But I'll let Meg take it away.
All right, sounds good. So just a reminder about why we do this presentation each year. First, we want to look at the levy's performance compared to its own overall goals, and those are based mainly on grantee goals. And so we're also looking at grantees' accountability compared to who they thought they would be serving, how many people they thought they would be serving, how well program participants participated in the services that grantees offer, and whether grantees achieve the outcomes that they set out to deliver. And then finally, to look at sort of better understanding of program delivery and administration over time, and where can there be potential improvements in service delivery. As Dan said earlier, we provided the first half of this presentation in November, and so in this second portion, we're going to look specifically at program participation in our various programs, outcome goals and performance by grantees, and staff turnover rates. And all of these data are for this past closed fiscal year, 2010-2011. So to get started first with participation data, this is the second year that we have been able to collect these data, and they tell us about the dosage of services that participants receive. So how much of a given service are participants receiving? These levels of participation are important because it is expected that certain amounts of participation are what yield the outcomes that our grantees project their services result in. So we look at participation to better get a sense of outcome achievement. And we're also trying to look at this data a bit more specifically by program area and by certain types of services to see if there are trends that are borne out in the data to tell us how much participation is reasonable to expect in certain types of services, or how well are certain services or certain program areas doing at having participants achieve minimum levels of participation in their services. So in this slide, what this graph is trying to show you is how well participants did at achieving minimum levels of participation in our programs overall. So all of our grantees set what we call a participation threshold for their program. That's a minimum level of participation at which they think people should participate in order to achieve the outcomes that are intended for that service. So what you're seeing in this graph in the first bar there is what the data looked like last year, and then the second bar is what the data looked like this year. And essentially what we're seeing is roughly 60% of participants in our programs last year and this year met those minimum participation levels. So we think that's probably a pretty likely trend, and we feel like we're likely to see that continue. When we take this data down to the program area level, you see a bit more variance by program area, which is not surprising because different program areas are serving different types of populations. So again, these are data that are looking at the last 2 years. The sort of tannish bar there, the bars on the left show the data from last year, and the blue bars on the right show the data from this year per program area. And what these are showing is by program area, the percent of participants who attended or participated in the program for some minimum level of participation that you would expect in order to achieve outcomes. So you can see that there are some trends there by program area. And in foster care, we didn't have data from last year because those programs were just in their startup phase. So program participants were enrolling kind of throughout the year and hadn't necessarily been around long enough to achieve those participation thresholds. And then the other area in which there's sort of the most variance is early childhood, and that's mainly explained by a change in how we collected data from year to year. So this year's data is probably a more accurate figure for looking at within early childhood what's kind of the expected number in terms of percentage of people who would meet that minimum participation threshold.
It is nice also to see in all categories it went up. It's positive.
Thanks.
Got to point out the good news.
Okay, so now we're going to just walk you through each of our program areas, some more interesting findings. What this slide is showing you is the percentage of children who, in early childhood programs, participated in multi-year programs for certain lengths of time, and it's looking at last year and this year. So the first bar is last year, the second bar is this year. And the reason this matters is that for multi-year early childhood programs, and these are specifically home visiting programs and early Head Start home visiting programs, for programs that offer multi-year components, research has shown that children who are able to participate for at least 2 years and then attend preschool are more likely to begin school ready for kindergarten than children who don't get that same level of service. More importantly, low-income children who do those 2 years in a multi-year program and then attend preschool are more likely to begin kindergarten at around the same level of kindergarten readiness as their middle-income or higher-income counterparts.
Could you repeat that last part?
Sure.
Okay.
Low-income children who participate in 2 years of a home visiting program and attend at least 1 year of preschool are more likely to show up at school ready to learn than children who don't get that intervention, but also are more likely to show up at sort of the same level of kindergarten readiness as their middle income or higher income counterparts.
And if I could say another thing that I feel like I keep hearing is that it's very difficult to change that rate, that when kids are showing up not ready to learn, they tend to stay behind. When they show up behind, they tend to stay behind. So that creates the achievement gap over time. And so it is doubly important, I'd say, that we affect that outcome.
Absolutely. So what we were sort of curious to know, and these are hard data to isolate, so this is our best kind of proxy for getting there, do we have some trend in children in our early childhood programs staying in multi-year programs over time? We don't have the sophistication to find out whether they also attended preschool. We don't get child-by-child level data from our programs. But we are able to ask our programs, are people staying in your program to the extent that they are able? And essentially what this graph shows us is that yes, the proportion of children who stayed in multi-year programs for closer to 2 years increased from last year to this year. And so what it probably also tells us is that children who enrolled last year are still in the program this year. So these are positive trends, and the closest we can come to sort of getting at some proxy for what that research tells us. So this is good news. And then the second sort of piece that we are able to look at was specifically with home visiting services and programs that offer parent-child group services is a little bit more detail about their participation in those types of services. So the first thing I'm going to talk about is service provision, and then I'll talk a little bit about the participation. In terms of service provision, what we know is that our home visiting programs provided over 90% of the home visits that they were contracted to provide for the past 2 years. So the services are getting delivered. More importantly, those same programs that offer home visits also offer group components. They're required to for the curriculum that they use, or because if they're an early Head Start program, it's a federal requirement for early Head Start programs. So programs that we fund that do these types of services provided twice as many groups this past year as they were contracted to provide. So they're getting their services delivered, and with groups, they're doing more than they need to be. In terms of participation, so how well are families utilizing the services that grantees offer, 85% of families met their home visit participation goals this year, and 2 years ago, 65% met it. So families are doing better or attending or completing more of the home visits than that. They're doing a better job meeting the home visiting goals of the service model. With regard to group services, about a quarter of families didn't attend a single group that programs offered last year. 2 years ago, that was 37% of families. So that's a pretty big chunk of families who never attended at least one group. This past year, only about a quarter of families attended 50% of the groups that were offered during the time that they were enrolled. So what that tells us is that programs are doing a great job offering home visits, and families are participating in them, but programs are offering a lot of group services for very little utilization. And so in the future, I think we'll be looking to work with programs to try to emphasize and keep strong their home visit delivery, but maybe pull away from their group service work and offer only the minimum, since families don't seem to be taking them up on as much as is offered. It should be noted that group participation is an issue that grantees readily admit, and the greatest barrier is transportation. It's very difficult for families to, if they don't have their own cars, to make it to groups, to take their kids on the bus, to stay home with a sick child when you're supposed to be getting to a group with another child. So it's not unheard of for group participation to be low, but we feel like programs shouldn't do such a intensive job trying to offer services that are difficult to get participation with.
I have a question about group services.
Sure.
So our grantees who, when they are providing these, they're setting up the groups, parents aren't arriving. We're still paying for that, correct?
Sure. Those same staff are usually the home visiting staff, so they're a critical piece of the service delivery.
So that's part of that's part of the whole contract or grant that we have is for that to happen. And would you say a little more again about a federal expectation or requirement under certain circumstances for some of the programs, but certainly not all. Would it?
Well,
is that true?
Our home visiting programs that are analyzed in these numbers there are two different types. There's early Head Start home visiting services. That's a federally funded program, and so there are federal requirements, and those programs are federally required to offer group services to their families. The other group of home visiting programs described in these numbers are parents as teachers, programs that we fund who use the parents as teachers curriculum. That curriculum, in order to use it and to be able to say that you are sort of a certified user of that curriculum, also requires that you offer group services. Though they are optional to families, the provider themselves, in order to sort of say they're using an evidence-based curriculum, has to do what the curriculum prescribes. So it's an interesting sort of piece of learning that the national sort of parents as teachers folks might want to pay attention to as well. But
we thought maybe of sending this data upstream a little and see if it has any effect.
Well, I guess that also,
sorry,
that was a good question, Julie. And are people getting less out of the program because they're not going to the groups, or are they offering them because they're required by other rules to
Well, they're offering them because they are required to do so, and they're required to do so by our contracts, too. We don't have necessarily contractual obligations about how much participation families should do at group. We do have how much group should be provided, how many groups do you need to provide kind of thing. And so we can certainly try to reduce our expectations around that so that staff are free to do as much of the home visiting as possible. But research hasn't necessarily borne out that you need extensive group participation to affect the kinds of child development outcomes that you want to affect with groups. Whereas home visiting, you get those effects more quickly and more readily. So it's a push-pull with groups. The biggest piece of the biggest advantage to doing groups is that children who aren't otherwise having some kind of preschool experience get that kind of social-emotional development piece, and parents also start to build social networks and sort of get a chance to engage in play and do positive parent-child interaction in a supported environment. But you can do positive parent-child interaction in a home visit. The biggest piece that the children don't get then is that socialization or those social-emotional skills of sort of like a preschool type setting.
With this slide, we'll take a look at utilization in child abuse prevention programs. Before we get into this, I'd like to explain the differences between the participation data in the previous slides and why we also look at utilization. In the previous slides, we discussed participation in terms of participants meeting certain thresholds. And those meeting the thresholds are the pool of participants for whom outcomes are measured. Programs typically have 3 to 5 outcomes that they report on, and in many cases, the threshold differs for each of those outcomes. For the purpose of aggregating the data in the previous slides, staff used the threshold data related to each program's primary service component. Another thing to note is that sometimes the participation threshold is set in terms of length of time engaged in services, typically 6 months, versus the amount of services received. Many of the child abuse prevention programs offer multiple service components. So to gain a better understanding of utilization, programs are asked to report on the number of participants that met specific levels of participation. So with that background, I'd like to walk you through the slide. This slide shows utilization for 4 program components. Starting on the left, home visits, parenting classes, children's classes, and groups. The first program component, home visits, only shows the percentage of participants that received at least 75% of the intended service, where the other 3 program components show, starting with the bar on the left, those who received at least 50% of the intended service, and the bar on the right shows those who received at least 75%. These data capture how well participants are utilizing the child prevention programs, the range of the services. And the news is good there. The majority of the participants are receiving at least 75% of the intended service level. Home visiting services have the highest rate of participation, while groups have the lowest rate of participation. This mirrors what we heard from Meg regarding the early childhood programs as well. I'd also like to point out that the home visiting services, that's the most common component across the child abuse prevention program area. 9 of 14 child abuse prevention programs offer home visiting services. By collecting this data over time, we intend to develop standards for each of the service components.
So just to go back, so home visits, 76% of the participants are
receiving at least 75% of the intended service. So if the schedule was to receive at least 1 home visit a month, then they were receiving at least 9 out of 12 home visits in a year.
And then the reasons for using that example, the 3 visits that didn't occur in that year are the family declining the visit or the provider not providing the visit?
Well, it could be a combination of both. Typically, there could be issues. A child is sick, so a home visit was canceled, and another was not rescheduled in time to be able to meet, to receive at least 75% of the home visits. I would say that's probably most common, but also if there's staff turnover in a program, then there you don't have the capacity to deliver all the home visits. So I can't give you the definite answer. It's probably a combination of both.
Okay, thanks.
With this next slide, we'll be reviewing the utilization of foster care programs. As with the child abuse prevention programs, we want to take a closer look at utilization than we're able to do with just the participation threshold data. While we were able to look at utilization by specific types of service components for the child abuse prevention programs, because there were several programs that offered the same types of components, that wasn't possible with the foster care program area because the services that are offered are so varied, and we have so few programs in that area compared to child abuse. Instead, we looked at specific levels of participation for the key program component in each of 5 foster care programs. As you can see, fewer than half of the participants in foster care programs received at least 75% of the intended service. While we don't have previous data to compare to, this level of participation seems low and is somewhat concerning because we know that more intensive services are needed for higher risk populations. While there is a concern, we also want to emphasize that this is preliminary data. This year's data will serve as a baseline for future measurements. Some additional things that
You're talking about children, you got to have a child in the audience.
I know. Everything stops. Additional things that we'd like for you to consider with this data is that data reliability may be a factor in the low utilization rate for some of the foster care programs as they're still working on assuring that they're capturing all the service that's delivered, tracking that, and reporting the information. And the additional challenges and complexities related to serving children and youth in foster care may also lead to lower utilization for the program services. And just also want to mention that over the past 2 years, programs have been working very hard to make program adjustments to accommodate serving children in foster care. Additional modifications may still be needed. Some programs may need to continue to adjust services to better engage and better meet the needs of children in foster care. Some may need to adjust the expected level of participation, and some really may need to change the method of their service delivery.
Okay, moving on to after school. I have a little bit of an advantage over these guys because more of my programs in my portfolio do similar things, so it's a little bit easier to group them. And so one of the things I was seeking to do in looking at the participation data that I get back from grantees is to try to get a better understanding of and this is also, again, for future granting purposes, what's a reasonable amount of participation to expect from an after-school program of a certain type. So what this data tells me, I don't have any fun charts, unfortunately, didn't lend itself to that, but for the last 2 years, it's been fairly stable that enrichment programs that we offer, so again, enrichment programs are usually focused on a particular skill or sub-area, and they're offered for less amount of time over a term or a year, as well as some of the full-service programs that are not SUN programs, where they're not the main SUN program. So, for instance, Step Up or Boys and Girls Clubs or other programs that are full-service in that they are offered at a greater level of intensity, as well as having parent engagement and academic support available and sort of other components that make them full-service and not just an enrichment. But for 2 years...
You have an example of an enrichment program, too.
Chess for Success is an enrichment program, or a bicycle club, or Ethos. Those are just the music program. So focused usually on a single activity and offered for less hours a week, typically. But the interesting thing is that for the non-SUN programs and for the enrichment programs, over a couple of years, they've been able to get about 70% participation, 70% of the participants meeting their threshold for outcomes for tracking, which is great in that it's pretty high, as well as it's constant. So that's starting to make me think, okay, well, that may be emerging as a baseline or a reasonable expectation. So we want to be, in general, looking for programs that could do that, that can repeat that year after year. So on SUN programs, I put them in a separate category. We're getting a rate of about 35 to 40% of the participating youth meeting their participation threshold. It looks a lot lower, but it's because mostly, if you look into the notes, I won't get too specific, but it'll give you more detailed explanation there. But the reason for that is that they have a different kind of participation floor than the other programs that we fund, because we were trying to align with the county and align with 21st century schools, which look at a 30-day participation minimum for outcome tracking in those programs. They use days instead of hours. Everyone else, we ask for hours. And you can see that, well, if you look at days, you could be coming for 3 hours on a day in some programs, or you could be coming for 1 hour on a day. And that would be a difference of, 3 times the participation amount if you stayed for 3 hours every day you came. So in other words, 30 days could mean 90 hours, or 30 days could mean 30 hours. And that's a pretty big range. So I have asked our SUN programs and worked with the county, who's been very cooperative, to help design reports where the SUN programs can also tell me how many hours folks are participating. And if you look into the notes, there's on the slides, you get about 60% of the youth in SUN programs getting at least 50 hours or more of participation during the year, and that is fairly close to what kids in the full service programs that were analyzed in the bullet above are getting. So you have a fairly similar level of service, even though the percentage meeting the participation threshold is lower. But it does give us, if we keep using this participation threshold in order to sort of align with our partners on this, that's about the percent. It's been fairly consistent again. So I can look across programs and say, okay, is a SUN program able to meet that, getting about 35 to 40%, attending at least 30 days, as well as looking at their hours breakdown. So I'm looking hopeful that the numbers stay stable because they're reasonably good, and that in the future that would give us a standard that we could look to when we're trying to fund organizations to understand what sort of participation they can get. So second slide, next one. Is related to return rates. This is the first year we have this data because now we've been up for 2 years on this set of programs. So one of the things I asked programs to track was what percentage of kids comes back the next year. So participates more than 1 year. Kind of to Meg's point earlier with the early childhood programs, same in after school. Research shows that longer engagement in a program usually yields better outcomes. Now, not keeping in mind that not all programs allow multi-year participation, as well as a program like SEI, for instance, that we fund that almost everybody participates for more than a year. So we took them out of the analysis because they require, essentially, or their program model is set up to make for multi-year participation. So we got good rates, I would say, on our first year of tracking the data. For full service programs, 43% are coming back in the second year, which is great. There's obviously a big range there, but that's the average. For enrichment programs, about 16%. So a lower range there, lower range of participation, but overall still good, especially considering that enrichment programs don't necessarily all allow multi-year participation. Some are set up only for 1 year of participation, like the bike program. You can only earn a bike once, so they don't allow you to come back the next year. I mean, they're actually thinking about changing that, but for the time being, that's been the case. So overall good, and we'll look to see if these rates stay stable over time, and also within programs.
I have a question about the after school. Seeing that you want attendance on at least 30 days during the school year, what would be the most number of days that our grantees are, like, say, SUN schools? Just to give me a perspective on what 30 days would be.
There are so many variations on that. I know it seems low, but there are so many variations on that theme. It's hard to give a consistent answer because some programs are so popular that although they are run 4 days a week, and so we set up in their contract they're offering services 4 days a week, they limit participation for any individual child to 2 days a week in order to allow more children at the school to participate. So there's things like that. So and then others you can participate 4 days a week. That's probably the high end. You can go 4 days a week up to 3 hours a day or 2.5 hours a day. So they have to vary building to building, and they vary program to program based on the local conditions of that school and what the demand for the program is, and how the individual agency, who is the lead agency, and that's what we're funding there, is the lead agency to offer that programming, what their decisions are. So they're offering many more than 30 days of service. So you figure 4 days a week for, school year is about 36 weeks, if I'm not mistaken, in that range. Some of them don't get up and going till October or mid-September anyway, a week or two after school starts, and they end sometimes a little bit before school ends. Some go the full gamut. So there is a range there. But like I said, remember 30 days, it could be 90 hours. And that's actually quite a lot. If you want to think about an enrichment program that might only offer 10 or 12 hours of service total for their class, you're talking a big difference there. Yeah. So, it's a substantial amount of participation in most cases.
Thanks.
Okay, going on to mentoring. Here are some stats that we keep track of, and we kept track of last year. Good news is they've gone up since last year on both points, which is good to see. We track how many mentees stay in the program that they enroll in for at least 6 months, and then those that stay in for at least a year. And the reason we track that is that there's research that shows that being in for less than 6 months is potentially harmful to the child, and so we certainly don't want that. And being in a year or more, and if you can stay beyond the year mark, is that much more beneficial. That's where you see, even more positive outcomes for the child. So we want our programs to be delivering this level of service if at all possible. So excellent news this year, 89% of matches were retained for at least 6 months and 84% for at least a year. So those are great stats, and they went up. And so I think really programs are to be commended for how well they're doing. I would say probably, if I were to guess, 10 to 15% of because you always have people moving. You have mentors who have to move or this or that. There's always mobility, that there's going to be some threshold by which you will not push, further down because of the mobility of people and circumstances in their lives that make it so they can't continue to participate. So good news and getting better over time. Okay, the last slide on participation data. So this will conclude sort of the participation or utilization section of the presentation, is around early exits. And what an early exit is in our parlance is we're looking at the percentage of participants that leave a program, that enter a program and leave relatively quickly before we would expect them to really gain any benefit from the program. And this is something that we want to understand, because we don't want that rate to be too high. We don't want, again, allowing for what I just said in regard to the last slide, there's a certain amount of people who have circumstances in their lives. They enter a program, they move, they lose their apartment, they get a new job, something happens, and they can't continue participating in that program because it's no longer convenient, or they change schools and the program isn't at the new school or whatever. So there's a certain amount of it you can't control.
Mentoring programs?
No, this is all programs.
All programs.
We are all programs. So for all funding areas, all programs, all 80-some, whatever they are. No, it's less than that are tracking this data, but 60 at least. What we saw was actually a very constant rate on the overall, so almost no change, about 11, a little more than 11.5% both years. So that's, again, telling us that may well be a baseline. That may not be able to push down much below that, just given the circumstances in people's lives. We did, however, see a fair amount of variation between program areas. So in early childhood, very low rate, you can see in the notes. I think Meg's theory on that is that programs, especially programs that offer center-based care or preschool programs, are very popular. People do not move out of those programs. When they get a slot, they stay. So there's less mobility. It's higher in after-school and mentoring programs overall. Maybe that the age of the child has something to do with it. I don't know if I really have a theory as to why it's higher. It's very low in foster care, and I think that is in some ways really encouraging because it takes, what we've seen so far is it takes a while to engage foster kids in services because of the complexities of their lives. And so we want to make sure that they're being kept in long enough for that engagement to occur. So it may also be a low exit rate at that level because people are doing their darndest to connect with the families and the children, and that takes time. So they're not going to prematurely exit anybody. So that, I think, is, the fact that rate is low is probably good. Okay. Any other questions on participation before we leave that area? No? Okay. Moving into outcomes. So outcomes are things that happen to children or families that we are looking for and that the program agrees that they're going to try to produce. This slide lists all the outcome areas that we're going to talk about here. Now, again, I want you to keep in mind that there's many more outcomes than the ones listed here that the programs are tracking because we're looking for outcomes that are appropriate to whatever intervention it is we're funding. But we cannot, because they're so varied and vast, we would be here all day if we talked about that data. If anybody's interested in the data on any particular program, we could can always provide that for you. But we're not going to go through all that in the slides. We're going to go through the outcomes that the most numbers of programs in those program areas are tracking that we can aggregate up for you. So before we start talking about outcomes, we always have to talk about the limitations because people want to jump to causality immediately, and we can't do that. So the data that we're telling you here and that we're going to discuss in the next few slides are descriptive. They are telling you what happened to the children in the programs during the year in question, or potentially in a year previous in some cases. Again, it provides information on the child while they were enrolled in the program. For the most part, our data are not longitudinal, as the woman Shannon discussed. Some data is longitudinal, goes on. She collects data after somebody leaves the program. This data is none of that. It's just while the kids are in. The other thing to remember is sort of like a concentric circle or a funnel, maybe. I think I've heard my technical assistance people call it a funnel. So when we start out, there's a whole group of people that the program serves, okay? Only a certain number, a smaller number, meet the participation threshold for outcome tracking. So when we're talking about these outcomes, it only is going to apply to that smaller number of kids that met the threshold, okay? And then of the kids who met the threshold, sometimes an even smaller group, not always, but sometimes, usually, were assessed, took whatever assessment that was required to understand whether an outcome was met. So there's many reasons why people don't take assessments or why that particular child didn't get one. But you're talking about a funneling effect. So when the numbers that you're going to see in these slides are going to be smaller than the numbers that were served by the program. Okay? So that's just something to keep in mind as we go forward. And with that, I'll let Meg take it away on outcomes for early childhood.
Okay, so in this slide, we're looking at, in general, across all of our grantees, the number of outcome goals that were met compared to the number of outcome goals that were set. So what the first bar is showing us from last year is that of the total outcome goals that were set by grantees, 87% of those goals were met. And the second bar is showing us for this year, 84.7% of outcome goals set by grantees were met. So we're having a sense that about 85% of outcome goals in a given year will be met by grantees. We think that's a pretty successful rate. That 15% is probably going to remain steady because with any sort of outcome tracking and goal setting, you're always going to have some issues in that area. For example, your goal might have been unreasonable. The data the tool you were using to measure that might have been inappropriate. It may have just been an off year. Your goal might have been 85% of parents will meet blah, 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 and you were 83% of parents. Therefore, you didn't meet the goal. So we think that 15% is probably steady and caused by a number of things. We have tried to control a little bit for sort of those questions about goals maybe set too high or set inappropriately, or the tracking tool maybe not being the best fit for measurement of the goal, by enlisting the help of some technical assistance providers for our after-school mentoring, child abuse and foster care grantees. And early childhood grantees went through that process earlier, a couple of years back. And certainly those technical assistance providers have helped us with sort of honing in and tightening up goal setting and goal measurement. So stepping away again from the whole and looking now back at program area by program area, I'm going to talk a little bit about the outcomes in early childhood. We've been tracking for the last several years the developmental milestones of young children in our early childhood programs, and there are 11 grantees in early childhood who have collected this data from year to year. And what's sort of interesting in this graph, as you can see in the trend, there's a kind of a big difference between what happened in fiscal year 08-09 and fiscal year 09-10. And essentially what occurred there was a change in how we reported this data to you all. We used to aggregate our child abuse prevention intervention grantee data with our early childhood data around child development. And so what you can see happening in 06-07, 07-08, and 08-09 is there's sort of a more consistent trend there in terms of what child development looked like with that group of both program areas grantees. And so child development for children in both of those programs combined was hovering around that sort of 80% mark. Well, once we separated out looking at children meeting developmental milestones in child abuse programs separate from children meeting developmental milestones in early childhood program, you see the numbers for the early childhood program go up a little bit. And that's probably not surprising because the developmental profile of children getting services in child abuse prevention intervention is a little bit different. They're at a higher risk for developmental issues given the stress in those families. And Lisa will talk a little bit more about that in a minute. But essentially what these data are showing us, that developmental trajectory for children in our early childhood programs looks pretty typical. Children are about 90% of children are on track with developmental milestones, and the other 10% are not quite meeting them, but making progress. National data for the Center for Disease Control says that there is about a national rate of about 17% of children showing developmental delay or disability in the national population. So our rate is hovering just a little bit above that in our early childhood programs. So I think programs are doing a good job, and children seem to be developing quite typically in our programs.
So does this show that, I'm sorry, I'm not quite understanding this graph. Is this supposed to be after they've gone through the program? I guess this is getting at causality.
It's not after they've gone through the program necessarily. It's while they're in the program. At some point, they're being tracked in terms of, they're being screened for their development. What typically happens in our programs and what these data are, what point in time that these data are specifically from is at least 6 months into services. So what we ask programs to do is report to us on the developmental status of children after they've been in the program for at least 6 months. Because when they first come in, there's a developmental screening that occurs, and then 6 months later, and every 6 months, they continue to do those screenings. And we want to sort of understand, what does the developmental profile look like of children after they've been in the service for some period of time, after they've met some minimum threshold of participation to show us the developmental outcome of those children. And so this is not a growth chart. This isn't showing us where they were when they came in and where they were some later point in time, because that would be slightly more complicated to show here.
Okay, because I guess it depends on how long they'd been in the program, because otherwise you could say, gosh, the children are actually doing quite well, maybe they don't even need these programs. If they're hitting 90% development, at least in that area, maybe they're...
Well, you could say that, but I think early childhood program literature would tell you that it's best practice to screen children consistently over time before they reach kindergarten, because the developmental trajectory of young children kind of ebbs and flows all the time. So they might be on track with certain milestones at age 2, but then an issue could emerge at age 4. So you kind of want programs to be consistently tracking those data at the program level. For the sake of outcome reporting to you all, we have to pick a point in time to make it easy and somewhat sensible for how they report their data to us. So there's sort of 2 different purposes for tracking these data, if that makes sense. There's what you need to do to monitor the child's development and help make sure that child's arrives at school ready to learn. And then there's what do you report for sort of accountability purposes or understanding typically what's happening in your program.
Thanks.
Yeah. So for other outcomes in early childhood, we fund a variety of programs in early childhood, and this slide sort of gets at outcomes that are occurring across a couple of other domains for programs that are tracking things in this area. So, for example, we're doing quite well in our programs are doing quite well in early literacy. Over 80% of families reported reading aloud with their children at least 3 times a week. In health, children who are eligible for screening were getting their screenings. Children who needed to be up to date for immunizations when they arrive at school, close to 80% of them were up to date. And in terms of parenting, over 70% of parents met their program parent education goals for the time that they were there.
With these next 2 slides, we'll look at child abuse prevention outcomes. For child abuse prevention programs, we look at outcomes that generally fall into 2 categories: child well-being and parenting. 4 of the child abuse prevention programs measure child development outcomes. The child development outcomes reported by the child abuse prevention programs support Meg's theory that child abuse prevention outcome data likely impacted the child development trend data. Fewer children served by the child abuse prevention programs met the developmental milestones as compared to those served by the early childhood programs. As Meg mentioned, this is not surprising given the differences in risk level. Child abuse prevention programs report on social emotional development separate from the other developmental domains because children living in high stress environments are especially vulnerable to developmental delays in this area. Research has shown that promoting children's social and emotional development mitigates the effects of various abuse and neglect risk factors. The majority of program participants were on track for this developmental outcome. As Meg mentioned, national prevalence data among children, delay data around children is around 17% according to the Center for Disease Control. The child abuse prevention programs reported that over 40% of children screened were not on track for one or more of the developmental milestones. Given that children at risk of abuse and neglect are a high-risk population living in highly stressful environments, it's not surprising that the percentage of children identified to have developmental concerns, especially as they relate to social emotional development, is higher than the national rates. This data indicates that our child abuse prevention programs are serving high-risk children. The programs are catching developmental issues early and are providing additional services and supports to help children in their development and help prepare them for school. Other indicators for child abuse prevention include child safety include lack of substantiated child abuse reports, positive parenting and family functioning, and improved mental health outcomes for children and youth. In each of these areas, you'll see that the majority of participants are meeting these outcomes. One of the differences in child abuse and also foster care is we don't have a lot of programs reporting on the same outcomes, so the numbers are much smaller. But one of the areas, the parenting outcomes, is probably the most reported set of outcomes in this program area, and they are a very important indicator of child safety and well-being. Next, we move on to foster care outcomes. This is the first year that we have foster care outcome data to report. As mentioned earlier, last year was the year of implementation, so many of the participants weren't in the program long enough to meet the participation thresholds for which outcomes then are measured. When considering this outcome data, it's important to keep in mind that the total number of participants for whom outcomes are reported is fairly small. Additionally, many of these outcomes are reported only by one program. 3 of the foster care programs specifically focus on families toward reunification and continue working with them after reunification. While the total numbers are small here, I think the outcome data is very encouraging, with over 90% of the biological parents meeting their parenting goals, and 100% of the families that were reunified, there were no substantiated child abuse reports after 6 months of reunification. One of the foster care programs specifically focuses on child health, and this is an important indicator. Research shows that children in foster care have significantly more health and developmental and mental health needs than children in the general population, and those needs continue even to go unmet even after their emplacement, unfortunately, in many cases. So I'm sharing this with you because the outcome data are very encouraging. The majority of children had up-to-date immunizations, even at a higher rate than we saw in the early childhood area, and they were accessing the services that they needed that were identified through assessments through this program. So that's very encouraging. And then lastly, 2 of the foster care programs specifically focus on school success. Again, the research shows us that the children in foster care are behind in school success as compared to children who are not in foster care. And the indicators and outcomes that were measured in school success also are encouraging and positive at this point.
Okay. heading down the home stretch. Last after school mentoring. One thing to keep in mind as you listen to me talk about this data, this first couple slides, I'm talking about data that is gathered from the school districts. Okay, so this is not something that the programs are gathering and giving to me. I'm getting this data from a third-party source who is kind enough to supply it to us. We don't ask programs for the most part, unless programs are very specifically dealing with academic issues, to report on this type of data, generally speaking, but we want to make sure, we just sort of want to watch it on a fund level to understand what's happening to the group of kids who are pretty much all, who are participating in after-school programs, obviously all are school age, and then mentoring programs, most of the kids participating in most of our mentoring programs are school age. So this captures data on them and just gives us a sense of what's happening to them. So again, I would say fairly stable data from the last couple of years. I didn't put past years on there because you're not talking about the same group of kids, so I don't want to sort of get people confused about that. But the numbers have been fairly stable. 80% of the participants attended at least 90% of school days. 90% of school days is kind of a benchmark, watermark amount of school to attend. Before if you start getting below that, we start worrying you're going to be able to meet any benchmarks because you're not just there enough to hear the teaching. So that was a good, considering we're pretty high, we're serving a pretty high risk group. 78% of the kids that are enrolled in our after school mentoring programs are eligible for the free and reduced price lunch program, which is the main poverty indicator that's used. So a very high percentage fall into that category. We're serving a high-risk population on the whole. The other piece of good news is 75 or almost 75% of the kids who had serious behavior referrals, so suspension or expulsion referrals in the previous year, had none in the current year that was analyzed. So that's excellent because that's a lot of our programs are working on social emotional skills, on positive behaviors, on controlling behavior, on conflict mediation, those kinds of things in the context of the programming. And so it's a key piece of information to understand that we're seeing fewer referrals and serious referrals. After-school mentoring data on academic achievement, not as encouraging on the whole. Partly, you'll see there's a few reasons to talk about that. So in reading and math, we've got stats listed for each, for the group of participants that were served in our programs, and then for the combined districts as a whole. So the number on the right is all the kids in the 5 school districts that are in the city, keeping in mind that portions of those school districts serve kids that don't live in the city. So not all, it's not perfectly contiguous, but it gives you at least a general sense. In reading, we saw 68% meeting their grade level expectations for the kids who participated in our programs, 77% for the combined districts, and 47 and 60 in math. We suspect, and this has been the same as last year since we've been collecting this data, that because we're serving a higher risk profile, so we're serving almost 80% of the kids are free and reduced lunch eligible. In our programming district, or for all of those districts, it's considerably lower, probably hovering around 50%. Possibly slightly less when you take all the districts together. So we're serving a higher risk profile population, and we would expect that, and we're also trying to identify kids who are at academic risk. So we're trying, I think it says that we're likely hitting them. The other thing to take into account with math, they raised the math standards this year. If anybody's a parent, you're probably aware of this. Quite significantly, and so you saw achievement levels in the whole state go down. So the percentage that are meeting benchmark have gone down and everywhere because the standard went up. So it's just I point that out partly as a reminder that any kind of a standard situation, you always have to remember, what is the standard and is it a moving target? So is it changing? And then, what does that mean to say that now 60% meet at least across the districts meet the higher standard, whereas probably numbers were closer to what the reading scores were last year. So how that game changes is going to influence these numbers from year to year. And if you look at a bar chart over time, you might see ups and downs, but it may not tell you what the real story is. So that's just something to kind of keep in mind as you look at that data, because I guess some of you come across that data in other contexts. So the last slide on after-school and mentoring programs is these are outcomes where the grantees themselves collected the data and reported it to us. So this is coming right from the grantees. This is not coming from a third source like the previous slides that are coming from the school district data. And these are the outcomes that are measured by the most number of programs: self-confidence, positive social behaviors, attitude and connection to school, and regular and improved homework completion, because lots of programs work on those issues. And you can see all good outcomes. We're happy with them, and I would say fairly stable over time as well. So overall, I would say with the exception of academic achievement, which is something we're continually working on, generally fairly pleased at the outcomes. Last slide looks at staff turnover. Not as much to say in the way of trends here. We saw last year was the first year we systematically tracked staff turnover on an aggregate basis, and we had a rate of about 14% of staff turnover. This year it was 20%, so a significant increase. I don't know that we have a theory to explain that at the moment. In fact, I was somewhat surprised because I thought, gee, the economy's so bad, I'm amazed anybody's leaving their job. But that apparently obviously was not right, since that's what happened. I would say that when you look at the chart there and it's broken down by program area, you see the significant differences between program areas. And the thing that popped out, of course, to us was the high rates overall in child abuse and foster care programs. And this is both not surprising because, as we discussed, dealing with very high-risk populations, very challenging work. And it's not easy to retain people in very challenging work that is not paid particularly highly. I think we also are concerned about it on some level because we're concerned any relationship-based programming like home visiting, as Lisa said, 9 out of her 13 programs in child abuse prevention do home visiting. When home visitors change over, that's a significant relationship for that client, and sometimes we see people not continue when the home visitor changes. So in relationship-based programming, it's a significant detriment. So I would say it is something we track fairly closely at the per program basis and are watching on a per program level. Do we see a high level of turnover? And if it's concerning, really trying to work with the program about what could be done about it if at all possible. So it's not terrible. I don't know that we would say we feel we have a trend in this. We're going to need a few more years of data before we can say, do we see it stabilize at something, it's consistent over time. And meanwhile, we'll continue to monitor it at the program level. To see what can be done to change bad situations at agencies, and sometimes this has to do with particular situations at agencies that can be rectified. So that concludes the data presentation for the year. And I would say if you have any requests for more data, more detailed data, we likely have it. So let us know. We will post the presentation in its entirety, both the demographics and all the stuff we went over last time, plus this will be up on the web by the end of the week. And then
what's that web address?
Oh gosh, Mary Gay, where are you?
PortlandChildren'sLevy.org.
So yes, if you have any further data needs, you can let us know, because we crunched an awful lot of data to distill it down to this level, although this may not have felt distilled to you, but it was, I can tell you. So in any event, thank you for your time, and I also just want to conclude by thanking our grantees. Part of the reason we have to bring this information to you is for accountability purposes. Grantees put a lot of time into being accountable to us for what they tell us they're going to do, and we spend a lot of time trying to hold them accountable to it. And that's part of what we want to do in public programming, is to make sure that people are doing what they said they would do and hopefully getting good results for children. So I appreciate you listening to this long presentation, and I commend our grantees for lots of hours of effort in trying to do a good job at this.
Well, thank you, and that brings this meeting to a close. And so I want to thank, as Lisa just said, thank our grantees for helping us get this data, and thanks to staff for compiling it. So thank you all for joining us today. Our next meeting is going to be March 5th from 10 o'clock until noon, and we'll be back at the Portland City Hall Council Chambers. And staff will be sending out reminders and agendas to everybody so that you can check your emails. Thank you, and we stand adjourned.
That was not right.
They got so much more elbow room up here than we do over there. I was like, wow, like spread everything out.